Okay, welcome to the Indonesia Project's COVID-19 webinar series. My name is Arianto Patundru, and I'm hosting this with Nurkamala Mulyani and Ruth Niki Julu. We acknowledge and celebrate the first Australians and pay our respect to the elders past and present. We are grateful for the support from the Australian National University and also the Australian Department of Foreign Affairs and Trade. So today we're going to talk about the impacts of COVID-19 on children and vulnerable individuals. We have three guests. Dr. Santi Kusumaningrum is the director of PUSKAPA, that is Center on Child Protection and Wellbeing at Universitas Indonesia. Dr. Maliki is the director for Poverty Alleviation and Social Welfare Development in Bappenas. And Dr. Woro Sulistyaningrum, she is the director for the development of family, women, children, youth, and sports, also in Bappenas. And I understand that they have jointly conducted a study on this topic, and also in cooperation with UNICEF and KOMPAK. KOMPAK is a DFAT initiative in Indonesia that focuses on governance to facilitate people's welfare and inclusion. As usual, we will have question and answer session after the talks, but if you want, you can write your question anytime on the Q and answer box, not on the chat box, and we will attend to them in the Q&A session later. Please also kindly fill a little polling when it appears on your screen, because we need this to improve our series. So that's a brief introduction from me to the topic, but let me first invite Santi to kick off the material. So floor to you, Santi.
Thank you, Arianto. Thank you, Nuke and Ruth, and the rest of the Indonesia Project team at ANU for this opportunity, and for my fellow panelists, Ibu Lisa and Pak Maliki as well. So let me try and share my screen. Does it look okay? Okay. Okay, so this policy paper, just a little bit of context before we dig into the material. Just a little bit of context that during the early months of the pandemic, I believe it was around April or so, Bappenas, supported by DFAT program KOMPAK and UNICEF, together with us, had this idea of developing a policy paper that looks more into providing a thinking framework about how the pandemic responds, and later on the recovery stage can consider the vulnerability of children and the marginalized individuals. So the main premise was that early on we realized that as a disease, COVID can of course affect anybody. But the way the disease transmits and spreads tells us one thing for sure, is that it really depends on your health risks and the other socioeconomic risks around you, because it might limit your options to keep yourself and your family safe. So based on that, we know that also because of even before pandemic situation, some people, including children and vulnerable individuals, might be in a position where their risks might increased, but also there can be some new risks emerge from this pandemic. So when this paper was developed, the government of Indonesia was already committed to protect the vulnerable people. However, the approach was still limited within the traditional definition of poor and ill. Mind you, because this was a paper that was developed last year and was launched by the Minister of Bappenas in September last year, the situation may have changed, and later on, Pak Maliki and Ibu Lisa would then inform us about the recent policy responses related to this. So in this discussion today, we, the three of us, and also the rest of the authors, would like to highlight the fact that some children and vulnerable individuals, before the pandemic hit, were already prone to having less access to basic services, to whom services were unresponsive, and were excluded from services and life opportunities. And this is the situation might have changed, because that's what usually happens during an emergency like this. However, we believe that the recommendations are still relevant, and this is what we are going to discuss today. And we're gonna, because the original policy paper covers quite a broad issues, and we try to discuss everything in related to risks due to the pandemic. We will try and focus our discussion today with a couple of topics that we think are less talked about in forums like this, and that's why this is very important. So first and foremost, we know that children can be affected directly by the disease, but they can also bear the consequences when their caregivers are affected by the disease. At the same time, we understand that there are at-risk children and adults who face the multidimensional consequences of the pandemic. And this paper discuss and explain the wide range of risk dimensions that might be experienced by these children and vulnerable individuals, starting from their health issues to begin with, loss of income, because some children do work and provide some support to their families, the limited social choices and safe spaces, alongside with the changes or loss of caregiving and social supports because of the isolation and the restricted movements and mobilities. Also the shifting schooling and peer bonding practices, not to mention the increased risk of domestic violence as well. All these dimensions of risk appear and happen while the basic and protection services are hampered by the pandemic at the same time. So during the first months of the pandemic, this was really a big issue. This paper then tried to offer a conceptual framework on how to understand how vulnerability happens and experienced by vulnerable groups. So this paper offers this conceptual framework to understand that vulnerability happens in at least 3 layers. Those 3 layers are interrelated. And at the first level, you will see people are lacking access to basic services. And this is due to poverty, remoteness, or immobility. And at this first layer, we become more and more able to predict because data becomes more available. But then if you have access, some people then experience the second layer of vulnerability. And this is where the services are not responsive to their special needs. And this is where the data becomes a bit more complex to understand. And then on the third layer is when perhaps their access, perhaps the services are ready and prepared, but some people are being excluded and discriminated by services because of who they are. And this relates with their social identity, starting from age, gender, disability, religion, ethnicity, and whatnot. And as you would see on this third layer, data becomes even more scarce. So the idea is that this framework, we think, can help a longer-term effort to measure the prevalence of well-being risks. But later on, as science evolves, we believe that this framework can also help in facilitating ways to measure prevalence of cases. And this is still a work in progress, of course. Using this conceptual framework, this paper has managed to map some vulnerable children and adults. And under the first group, what we call those whose risk can be estimated through existing data. For example, even SUSENAS, the national socioeconomic surveys. So they're not that invisible, but their problems were sometimes overlooked. And these are the 6 sort of areas or groups that fall under this category. And as you can see, the first one is quite common. People, including policymakers, are instinctively knowing that they need to address extreme poverty. But then how about households headed by single parents, households headed by elderly, and also households headed by children, because child marriage is still an issue in Indonesia. So these are some of the examples of groups that fall under this category, whose risks can be estimated. However, their problems were sometimes misunderstood. And on the last group under this category are children, the elderly, and people with disabilities without legal identity. And we will speak about this more later. The second category are those who are more invisible. And they usually exist in ad hoc program data, although it means that they might represent a fraction of actual cases. And this includes children in detention and correctional facilities, including children who are living with their caregivers who are being incarcerated, because in Indonesia, up until you're 3 years old, you can live with your mother who's being incarcerated in Indonesian prisons. Children in institutional care facilities or panti, children in boarding schools, children who are living with their families but receiving social assistance from social care assistance from social workers, for example. And these are the examples of the group that belongs under this category. And the third category are what we call the most invisible, because they are basically missing from the statistical map. And interestingly, they might overlap with the first category that, whose problems were often misunderstood or overlooked. And under this are the undocumented, or people without legal identity documents, but having no way of getting them registered because the system hasn't been able to solve the problems. And of course, the stigmatized, marginalized groups. So I'm gonna then start to discuss what are the risks emerge from the lack of legal identity documents, which sounds quite straightforward, but I'm sure you are also following the news of, the social assistance recipients are lacking NIK or single identification number. But this paper actually discussed that it is more than that. It is more than a superficial NIK or no NIK problem. Because on the one hand, children and vulnerable individuals who do not have a legal identity documents might be blocked from accessing basic services and protection services. And we have data later on, I will talk about that it might be associated with lack of health insurance. And at the same time, because the ownership of documents reflects the actual data management in terms of population administrative data, then it means our administrative data is incomplete. And it makes it very hard for programs to use it and basing their planning and delivery operations on. This is an example. So using SUSENAS 2019, we see that in Indonesia, there are still over 1 million elderly and over 400,000 people with disability who did not have a single identification number. But if you remember, the president mentioned this 8 focused provinces during this pandemic. 61% of the elderly who lacked an NIK reside in these 8 focused provinces, as 57% of people with disability without an NIK were populating the eight focused provinces as well. More, there's about 6 million under 5-year-old children who were without a birth certificate. And 53% of them are in these 8 focused provinces. And 44% of children under 1 still did not have an NIK. This is based on the 2019 data. But what does it mean actually? So luckily for us, Susanas follows ownership of birth certificate over time, annually during their surveys. And you can see that basically we're doing good in sort of filling the gap of birth registration deficiency among children 0 to 17. But this graph shows us that there's still some really huge problems in terms of at birth registration. And if you look at the data more deeply, the birth registration started to peak during the primary school registration age. And this might be good for them who can still access schools because they then register their kids and can produce birth certificate based on that. But it means the whole country is missing the first 5 years of someone's life data. And this is problematic because as an ICA is sort of produced on a family card, it means if some children under 1 still are lacking an ICA, it signals to us the situation where family cards in the household might not be that updated, while at the same time, programs sometimes rely on family cards information to design their intervention. So then there lies some problems. Also, through our additional work, our other work with GFAT KOMPAK program, we managed to conduct several surveys and did some statistical analysis within our surveys. And there's some associations we found between not having a legal identity documents with some of the inequality markers at the service. For example, it associates with head of households literacy level, the household's poverty level, the preschool enrollment, but also further schooling beyond primary school, a complete basic immunization among under 5s, and also access to health insurance. So that is everything about legal identity and why it might sound straightforward, but it actually reflects a bigger problem we need to address immediately. The second is that we know that poverty never stands alone. Violence never happens alone, discrimination also. And now everything is sort of intersecting and they continue to stall child development and of course take a toll on human capital and economic growth in Indonesia. However, these 3 sort of main problems were still addressed in a silo, while more and more we see during this pandemic that because of the problem is actually intersecting, because life adversities never happen just one and never happens alone, and the responses were fragmented, then it sort of heightened the risks for children and vulnerable individuals. This is just a few examples. So more than half of children who ended up in panti or care institutions in Indonesia were not there because they lost both of their parents. So it's not because of orphanhood, but they're in panti because of poverty, because their parents want their kids to access education, and also because their parents think that they can receive better care in panti. So I think this can also be a starting point for our discussion. Then where are these children in the whole scheme of this pandemic response? Over 100,000 of them are living in panti. 54,000 of them are in the 8 provinces. 54,000 of children living with their family are receiving care assistance from social workers, indicating their vulnerability. And 20,000 or so of them are living in the 8 provinces. All this while we in Indonesia only have about 3 social workers, professional social workers for every 1 million Indonesians. So how can we address this issue? And not only the lacking of social workers numbers and capacity, but also the government has put so much priorities into cash transfers, while we know from learning from other countries and from global literatures that cash transfer alone will not work. cash transfers has to be accompanied by a set of social care services, and it can only be provided by social workers, community facilitators, or volunteers, for example, who are trained to provide families with home visits, case management, conflict resolution, and whatnot. Okay, so what do we recommend out of this? So we have a set of short-term and longer-term recommendations, but for this discussion, we would try to conclude it in two ways. So we basically recommend that this pandemic is a starting point for everyone to start thinking about regoverning first population data, second service deliveries, and third protection and welfare systems for children and families. And by population data, we mean data that are administratively collected through a vital registration that counts everyone from birth throughout the life cycle until death, and that is interconnected with other sectoral data. These services must be available at the village level. They must be cheap, easy, and inclusive. The data has to be managed in an accountable way. The data has to be available for government sectoral technical ministries so they can use that to allocate their resources. And I think our 2020 census was operated using the population admin data. And this is a huge opportunity to start tracking the census people who were lacking legal identity documents and captured during the census. And overall, all these four basically main recommendations need to continue while we strengthen the overall civil registration and vital statistics system in the country. And our partners in this policy paper, such as GFAT programs KOMPAK and also UNICEF, were really supporting this effort as well. And of course, everything is championed by Bappenas. Secondly, what do we mean by a comprehensive social protection, comprehensive protection and welfare systems? And this is a system that operates through a three-pronged approach. And one is social protection, where families and children and vulnerable individuals can be facilitated to access basic services, legal identity, social assistance, and livelihood. Second is family support, where families are being supported by home visits and all this assistance to help caregivers care for children, elderly, and people with disability. And the third prong is specialized protection, where immediately people can be referred to services that can minimize incidents of harm or respond to incidents of violence. And I think I would close by saying this is still a work in progress. We still have lots of homework in front of us. And some of the immediate take-up example of these recommendations were when KOMPAK facilitated Minister of Village in using the recommendation to support their integrated and village-based vital registration to register beneficiaries of village fund cash transfers. And also later on, Ibu Lisa can speak more about how the effort of building a more comprehensive protection and welfare system continues. I would stop there. Thank you, Arianto.
Thank you, Santi, for the comprehensive information. So let's now hear from Pak Maliki to continue the presentation. Silakan, Pak Maliki.
Terima kasih, Pak Arianto. Assalamualaikum warahmatullahi wabarakatuh. Selamat pagi, salam sejahtera bagi kita semua. Good morning, ladies and gentlemen. Thank you for the invitation, Pak Arianto. And also, before my presentation, I would like also to appreciate for the government of Australia through DFAT because of their support through several projects. Such as KOMPAK, and then also Mahkota, Mampu, and also Peduli. Because I think not only one particular project that have supported us for the policy formulation, but also all of the projects I think become a very strategic inputs for us so that we can formulate more integrated and coherent policy especially for the social protections improvement in Indonesia. And also this project is also working together with PUSKAPA, Bu Santi, and Bu Woro, and also supported by UNICEF. If we are speaking about vulnerability, we are talking actually about everybody. So especially during the pandemic of it, we are looking at here is the possibility how the people from one segment of the economic welfare level that come down to lower economic level, such as like the aspire middle class people can and possible to move to the vulnerable, become vulnerable, and also the vulnerable become poor as well as become very poor. And the possibility is that the more vulnerable you are, I mean, the more the lower economic level you are, the more possible that you also become very, very vulnerable later on during the pandemic of it. Such as that those who are in the aspire middle class have chance to like around 27% to become vulnerables. And while the vulnerable become poor and very poor is higher chance, have a higher chance. So this is for everybody. So one particular example is that when parents, especially actually the productive age groups, when the productive age groups have like in one particular level, so it's like in the middle class, they have like they lost the job during the pandemic of it and become the vulnerable, and then they have to stay at home because of the lockdown. It's also, but then they also have the pressures. So this kind of conditions not only affect the productive age group itself or the parents, but also the children. As what Bu Santi already mentioned is that one of the vulnerability of the children is because of the parents lost the jobs. Yeah. So this is one of the description is that actually the whole populations is have their own vulnerability. But then if we are talking about the children, I think they are also the most vulnerable segment of the populations that we have. So the children itself are actually vulnerable even before the crisis. If we are talking about the poverty among the children, they are higher. Yeah. So when we look at this, the profile among the productive age groups, say it's like 17 to 60, they are the lowest poor groups in the populations. But then when looking at the 0 to 17, they have a higher population rates. Now that we can see also actually the elderly have the higher chance of become more poorer. But it seems like the elderly maybe they can have some escape for these conditions. But when the children are in the poor conditions and they're still depending on their parents or their productive age groups as a member of the family, I think it will also create some dependability as well as the vulnerability. So Bu Santi already mentioned about the birth certificates as well as the identity of the children. The children itself seems like already vulnerable for getting birth certificates. Some of them is that still doesn't have it. But when we, I'm sorry, some of them is in Indonesian. But then when we are looking at some specific conditions, as like a poor children, they also have the more probability that they don't have the birth certificates. And then we added up to the condition of these poor children with people with disability. So we are talking about poor and also disability, with disability. So the chance is even higher. And the difference between the poor and the non-poor is even like triple. You know, before, just like poor and non-poor, it's only like double. But now, those who doesn't have the birth certificates, the children who is poor and also with disability have like a triple percentage of those who doesn't have the birth certificates. Yeah. I think this one is also affect the other basic services. Santi already mentioned about the health access and others. Yeah, when we show it here is like a school participation. Between the poor and also the non-poor, there is a chance that they also are not enrolled at school or even have lower school participations. So this is like only very partial conditions of how actually the children is quite vulnerable, especially those who are poor as well as with disability. So during the pandemic of it, we have our own conditions, yeah, including the children. The children have their vulnerability with a few factors, especially if it related with our policy formulations. The first is on data accuracy. This already mentions also in the study that especially those children who lived outside the family. If Bu Santi says have an analysis on SUSNAS, then we are talking some of the children that actually on the households, inside the households system. But then we also have to consider those children who is living outside the family. I think we also have another study about Santi about this one, and then we are looking forward to have like a more specific study on this one. But for now, we still kind of we are as a policy makers also vulnerable because we don't have a data, more accurate data on the children who lived outside the family. And then the child labor. Child labor is still quite high. It's not only the economic conditions, but also some of social, some of also social aspects that maybe become consider them as have to work in the family. Services also quite limited, especially social services, and of course the basic services that we already talked about. The environment, yeah. Also that the environment that lack of responsive to the children's needs is also one factors that we have to consider. I mean, this also very depending on how the data is available, because if we cannot scan the whole conditions of the children, we don't know who actually potentially have some of the problems, social problems in some environment or in some neighborhoods. Yeah. And then the family, we also still have to develop the system of the social support environment in the system for the child care. So this is all the factors that make the children vulnerable. During the pandemic of it, I mean, we are quite specific on this one. I mean, first, we already mentioned about the loss of income that can lead economic instability in the family. So once the parents already lost the job, the mentality, the social problems in the families become higher and higher and become the burdens of the family that usually fall into the children's well-being. And then the restrictions in school activities. You know, when I heard about the online schools, maybe it is good for some good quality schools, but even in Jakarta, like the public school doesn't have quite good programs for online system. Some we already have the internet or the infrastructures, but I think we also have to develop the curriculums. This is like, I mean, some of the schools have lack of this one. So then the restrictions of school activities can potentially reduce the knowledge and also competential standards. So we are talking about Jakarta. Even I think farther from Java, it seems like we also have quite a lot of problems. Online learning is still difficult to be implemented, especially for those who have a disability, I guess. Yeah. For the poor and vulnerable, we are trying to support them, but I'm not sure about the infrastructure, whether they have it or not. So this is something that we also have to think about. Health access is quite limited, especially for stunting. Those children, I mean, for the poor family, for the poor and vulnerable we already have supported by food assistance, but somehow the parents still, the parents' choices of the community is still not really towards the children well-being either. For the care and safety, the social distancing policy also could potentially make worse the conditions of violence, abuse, and also neglect in terms of the child care. So we know that we have quite a lot of limitations during the pandemic COVID to respond all this vulnerability on the children. But this is actually a quite huge lesson learned from us, for us. Yeah. For Bappenas, in Bappenas, we are trying to acknowledge all of this lesson learned, and we are looking forward to have the reform, especially on the social protection reform. The impact is that we are trying to make it a zero extreme poverty. Yeah. Even maybe in the SDGs, the target is have to be aimed in 2030, but our president asked us to accelerate it to achieve it in 2024. Some of them is actually address those vulnerability factors that we already mentioned, especially on the data. I really looking forward to have a very sophisticated data that can also see or analyze the condition of the children. So one that we are looking forward is that we have to develop the socio-economic registry for the whole populations. Yeah. But we realize that for children, for these people with disability, for the elderly, I think we have quite thorough conditions, especially for their social well-being as well as the health conditions. So this is something that we are also looking forward to. And then integration of the programs, not only basic services that we are looking forward to improve the access for the children, but also how we can also develop the social protections, including the social services here. And then the one is that the most important part is the number 2 is adaptive social protection. So once there is some natural shocks, climate change, as well as the pandemic, then we still can have quick response for the policy to respond for the vulnerability of the children, not only for the economic well-being, but also the social well-being as well as the health well-being. Yeah. This is our visions of the social protection. As we see that there is like integration between the social insurance, social assistance, and also the social services. We aim that social assistance only for those who are vulnerable, poor, and chronic, and those children who are categorized. And this one is, I think, eligible for the social assistance. But then, if we are talking about social services, it's not only for the vulnerable, poor, and chronics, but also for those in the middle, aspire middle, and also the upper class. So this is what we are talking about. If we have the data, not only like the socioeconomic, but also their well-being, the health conditions, and the other like psychological conditions. I think this one is very powerful. Then we can see what is the needs that we can interfere for them, especially for the social services for children as well as the people with disability and also the elderly. The social insurance, of course, this one is for the whole population. Specifically on the social protection for the children, we are looking forward to have strengthening the quality of social protection. That's including social services and rehabilitation for all children, including those with special needs. Improvement of access to basic services that are integrated and inclusive, and data integrations of children beneficiaries. This one is to ensure the poor and vulnerable children outside the family receive the same social and educational assistance. So lastly, the way forward, we have to have a further analysis on variation of child poor by place of residence. I think thanks for UNICEF, we also have this working plan for this one for this year, I guess, with the same also with longitudinal survey, Santi. We have to do it as soon as possible. And then we need to strengthen the program integration to address children vulnerability. And we are looking forward for DFAT for keep supporting us with this. Thank you, Bu Kirsten, Bu Jo, and also Astrid for always supporting us for these activities. As well as the local government capacity. I think KOMPAK also is supporting us for this one. We have to enhance their capacity. So then integrations is not only within line ministers in the central level, but also in the local level. By doing the data, multi-sectoral data analysis, multi-dimensional intervention based on the evidence. And then institutionalizations, monitoring, and also reporting social protection for children, including establishing a periodic interagency report. So that's all. Thank you.
Thank you so much, Pak Maliki, for the information and insights for the lessons learned from the COVID-19 from the point of view of Bappenas. So let's continue on with Ibu Lisa to also give her perspective from Bappenas on this topic. So over to you, Ibu Lisa.
Yeah, thank you very much, Arianto, and also thank you for inviting me into this webinar, and also really appreciate for the support from the government of Australia for through KOMPAK and also the UNICEF to provide this study, because I think this is a very important study, especially for the government to make sure about what the next policy that we have to prepare to protect our children. Next slide, please. If we talk about the children, there are if you talk about children, there are 84.4 million children in Indonesia, or almost 1/3 population in Indonesia. So I think this is a big population, and it makes the government to take a serious action in protecting the children and also their rights. If we talk child protection development, there are 6 dimensions that has to be addressed, which consists of children's basic right fulfillment, child abuse and maltreatment prevention, special protection for children, affirmation for children in special condition, and child protection system, and also child-friendly environment. And additionally, if we talk about the child protection development in Indonesia, there's a consist of 4 important factors that has to be considered. Firstly, in applying the child protection program, we have to consider the differences of child characteristic and needs. That's why in the study, we have to make sure that all children are covered by the program, because they have a different characteristic, they have different needs. By understanding these points, we can truly understand what the root cause of the problems and what the right program that we are taking, that we have to take to tackling the problems. Secondly, multi-sector issue. Child protection is a sector that related to many issues, not only about the children itself, but also influenced by many circumstances surround them. For example, like a family, community, environment, and also the government policy. It will impact on the child development also. Additionally, child protection also related to many sectors of development, such as health, education, social, and etc. So this makes us have to be considered that if we talk about the children, not only the children itself, but we have to make sure that all sectors have to be put the children in their program also. Thirdly, we have to concern about what different needs in every phase of the children's life cycle, because every stage have different needs and will impact on different intervention that that should be give to the children. And fourthly, cross-sector intervention in different level is needed to make sure that children can get their rights and protected from any violence and also neglected, exploitation, and other maltreatment. As we know, there is a common proverb that that we all already heard. Yeah, we need one village to protect one child. So the collaboration is a key if we talk about the child protection. Due to many aspects has to be considered to protect the children, child protection issues spreads across various development sector in our medium-term development plan. We have already a medium-term development plan 2020 to 2024, and in the next slide I try to give like a very brief about how we put the children concern in almost all the program priorities under the priority number 3 and priority number 4. We have 7 national priorities in our medium-term development plan. I will focus on the national priority number 3 and number 4. Next slide, please. If we talk about the national priority number 3, increasing the quality of competitiveness of human resources, we can see that almost all the program priority in this national priority is related with the children. For example, if we talk about the program priority is social protection and population governance, will relate with how we accelerating population administration coverage. It relates with what Bu Santi have already mentioned about how we make sure that the children have NIK and also have like a child what do you call it, akte kelahiran, what do you call it, akte kelahiran. That is the thing that we have to be considered in the social protection and population governance. Another example, for example, in the improving health service toward universal health coverage. In this program priority, we talk about improving maternal, child health, family planning, and reproductive health, and also increasing disease control. And in the education, for example, in the program priorities number 4, we increasing equitable access to education services at all levels and accelerating implementation of 12 years compulsory education. And in the program priority number 5, this is improving the quality of life for children, women, and youth. This is have a special issues on child rights fulfillment and protection. So I think if we talk in the medium-term development plan, the children issues is spread across many sectors actually. And next slide, I will focus on the program priority number 5 in the national priority number 3. There is 3 indicators that we use to measure the development of the children. First is the Child Protection Index and also the profession women aged 20-24 years who married before 18 years old. This is a child marriage. And also the prevalence of child aged 13-17 who have experienced violence throughout their life. This is a violence against the children. So this is the 3 indicators that should be achieved during 5 years development. And the strategy to achieve that target and this indicator is to realize the child-friendly Indonesia by strengthening the child protection system that is responsive to diversity and the region characteristic to ensure all children can enjoy their rights. There's several strategy implementation, including how to strengthening the regulation, law enforcement, strengthening in the institutional effectiveness, increasing the understanding of child protection, strengthening network between the government and communities and other sector, increasing children's participation, strengthening effort to prevent the deal of various acts of violence, and strengthening the coordination synergy in effort to prevent child marriage, and also strengthening family care and temporary care in other institutions and increasing access to basic services. So this is the strategy that we use to achieve the 3 indicators to have child protection in Indonesia. Next slide, please. Beside the national priority number 3, we have a national priority number 4 that focus on how we improving the quality of the family. In this national priority, we try to make the family become one of institution that can build the children's character. So this is under the national priority number focused in national priority number 4. And next slide. What we will done in this national priority, we have 2 indicators as a measurement. Is a family index, development index, and also median age at the first marriage for women. So this is try to help that before we enter the family institution, we have to prepare. They have to prepare. They will give the like an education, life skill to become like a parent. It's a good parent, because I think this is a good for nurturing the children. And also improving the quality of life of women, of families' life cycle, and also embodiment the conducive environment through strengthening communities, institution, regulation, professional facilities, and infrastructure. So this is the strategy that we will conduct to improve the family, the quality of the family. Next slide, please. So what happened during the pandemic that Pak Maliki has already mentioned? There's given the pandemic given an effect to the children. The large scale of restriction policy, PSBB, brings various impacts on many sectors such as economic and social, that already mentioned by Pak Maliki also. This condition contributes to increased vulnerability of the children. In health sector, there are some circumstances that able to influence children's health, such as there is a immunization delay or reducing food consumption as an impact of less family income due to some economic condition. As a result, children will experience malnutrition, stunted in development, or stunting. Additionally, decreasing of family income and lost job of parents influence the welfare of the children also. In education sector, there are several impacts of learning method transformation from online to distance learning online. In this case, some children are facing unpreparedness of infrastructure, whereas some of the parents and teachers do not have enough ability in facilitating the learning process. Moreover, the long duration of distance learning will affect the mental health of children, such as boredom, stress, and less motivated. And we can see that there's another impact because the children, using gadget in almost every time. Yeah, they can connect to the internet, and this is become the high risk for the children, because they can get influence from negative information from this media or social media and so on. So this is the impact because of the distance learning process. Violence and harmful practices is also risk that might be experienced by the children. The pressure during pandemic potentially cause domestic violence against children. Subsequently, children also forced to work, and also they forced to be married in very young age in order to help family economic condition, and also influenced by advertising in the online website. So this is the impact of the from the pandemics, yeah, to the children. Next slide. To respond to the pandemic condition, the government already have some intervention in order to protect the children. The intervention was carried out referring to the child protection strategies in our medium-term development plan with adjustment to some protocols because we need to adjust the protocols during the pandemic period and focus on different needs and characteristics of the children. There are 4 main interventions that have been carried out by the government. Firstly is the program to reduce vulnerability of children. This program is really important as a rapid response to children who are affected by COVID. This intervention is delivered by giving social assistance such as, I think this is Pak Maliki's responsibility about the PKH, Program Keluarga Harapan. It's a family hope program, and Kartu Prakerja, Kartu Sembako, subsidy for the electricity, cash transfer to the special for the targeted group, and also the bantuan sosial for sembako, Jabodetabek, BLT Dana Desa, and many more. Moreover, to directly reach the children who affected COVID-19, Ministry of Women Empowerment and Child Protection deliver specific aid for children, especially for children with disability, children aged 5 to 17 years old, children aged 3-4 years old, and children aged 0 to 2 years old. This assistance categorized by several groups based on their needs. Secondly, enhancing understanding and preparedness is really needed to ensure all people get the right information about this pandemic and can handle the situation if one of the family or community impacted by the COVID. Ministry of Women Empowerment, Child Protection has mass movement called Gerakan Berjarak. And also additionally, BNPB, this is the institution who are responsible for disaster mitigation, has program called Keluarga Tahan Bencana. What is called family resilience from disaster. Besides, there are also many tools of communication, information, advocation, and also education through various methods such as media, leaflet, consultation group are developed to give like a knowledge for the family, for the children, to the service provider about how they can deal with the child protection during the pandemic. These interventions are really important to build resilience and readiness for children, family, and also the service provider to face the pandemic, as well as also raise the social capital and empathy among people in communities. Thirdly, provide and enhance the effectiveness of service, especially for mental health and violence. This intervention begins from establishment of many protocols that regulate some handling procedures during COVID-19, and furthermore, they also establish mental health services called Sejiwa that can be accessed by phone. In order to give comprehensive protection to the children as victims of violence, the UPT DPPR is also P2TP2 is a unit handling the violence against the children, remains operate with some adjustment in mechanism. To improve the services in the local region, start from 2021, the government gives special allocation trust fund to province and district level to improve the capacity of the UPTD. So this is one of new intervention from the government to improve the quality of and the capacity of this unit in handling the services for violence against children. Fourthly, post-pandemic rehabilitation. This intervention is the macro level with the push of the transformation of health system and social security system that has been explained by Pak Maliki in the presentation. Next slide, please. Although we already tried to respond pandemic from many aspects, there are still several challenges to give protection for children during pandemic. First is special condition and various characteristic of children in Indonesia that we already acknowledged from the study. Children condition in Indonesia are not homogeneous. They have different characteristics and condition. For example, there are children who live in remote areas or outside family. Those children need different treatment and method of intervention. And also another example is children with special needs. In jail, for example, children in indigenous community, children in the street, children in disaster, who are also have different needs. Second is about the data and information system that's still inadequate. We still have a weak data and information system. This is important because data is a significant aspect to determine the program target. In pandemic context, children who are affected not only who live in a poverty line, but also children in several groups of society, which are need to cover in the existing data system. That's already mentioned by Pak Maliki that we will improve the data and the system information that can be covered all the children with the several condition and characteristic. The necessity of collaboration in multi-level intervention. This is a very important because child vulnerability is influenced by many external factors. Therefore, multi-level intervention and collaboration among various stakeholders is needed. And the fourth is child protection still seen as a second layer issues in development due to health, social, and economic sector becoming priorities during pandemic. So the budget of child protection has been decreased. And it's a big challenge for us into implementing the child protection policy. That's why in our plan, next year plan, we have to identify what kind of resources that can be used to implement the child protection policy, not only from the government budget, but also from other government for other resources. For example, from development partners, from the private, and also from other resources. So that's why for ending this presentation, I will give like an appreciation to the government for Australia who always support us in implementing one of our policy, especially for implementing child protection policy. For example, in the Mampu project, which is under my coordination, we work a lot with the CSOs to empower the women, also to improve the capacity of the local government to build like a regulation and a policy to prevent child marriage. So this is one of a program that really helped us to implement our policy, the government policy in preventing child marriage. Another program is from the IPJ second. This is also the program that really helped us to empower the law officer to to give their knowledge about how the child protection, how about how to prevent the child marriage, and so on. So we really appreciate for the government of Australia support on those through those programs. So I think this is end of my presentation. So thank you very much.
Thank you very much, Ibu Lisa, for another very comprehensive presentation. So let's now move to question and answer. I see 3 questions there in the Q&A box. I will just invite Endah Nirarita and Terry Hall to ask them directly, and then I will read Vania's question later on. So let's start with Enda. Is Enda Nirarita? Yeah.
Yeah. Hi. Good morning. I'm Endah Nirarita. My question is to all the resource person. How do you see the role of CSO, LSM, in the context of current condition in ensuring that vulnerable group get post-COVID recovery services and program from the government? What are the strategic roles that can they play at the moment? I mean, because I think most of the program that was mentioned before, it's also include CSO. How do you see their role in the future? Thank you.
Thank you, Enda. So for the interest of time, let's just take the questions first and then answer them. The next question is from Pak Terry. Silakan Pak Terry.
Thank you very much. Excellent presentations, and a whole lot of issues have been raised. What I am most concerned about is the quality of data that has been raised by all three speakers. The concern that there is a very large number of people who are not having births registered. We know that death registration is severely undercounted. We also have seen in the recent results of the 2020 census that the 2020 census results show a huge underenumeration of 0 to 4-year-olds and a misenumeration of a lot of people in other age groups. The census this time around has been done in collaboration with the civil registration system run by the Ministry of Home Affairs. I'm concerned that both Home Affairs and the BPS suffered great budget reductions in 2020, and this may explain some of the data problems that we see. 2021 will have a sample census to improve the quality of census results. And I'm wondering if the speakers could describe to us how the government would plan to increase the budget for data collection and guarantee that that budget would be used throughout 2021, and how the data that have been collected so far can be made accessible to all of the academics and policymakers and CSO members who want to adjust and improve the data quality. Thank you.
Thank you, Pak Terry. I'll move Vania's question to the second round because I see one hand raised, and that belongs to Pak Budi. So can I invite Pak Budi to ask directly? Silakan, Mas Budi. Apparently he's not ready, so I'll read Vania's question, and this is to Pak Maliki. So Vania's question is about whether there is a plan or by the government to.
Sorry, Cok.
Okay, Pak Budi, silakan.
Yeah, sorry, Cok. Pak Cok. First of all, thank you, for Bu Santi, Pak Malik, and Bu Woro for an insightful and very informative presentation. However, I don't know whether my impression is right or wrong. What are the problems seem to be the general problem on softening the burden of children and vulnerable people with or without COVID. So what I mean is that whatever program that seems to be proposed should be conducted even without COVID. So, so my puzzle is that, so what is it that specific due to COVID that we do that program, and if there is no COVID, we might not want to do that program. So thank you. If there is something like that, that could be a priority. Thank you.
Thank you, Mas Budi. In that case, because Mas Budi's question is related to Fania's question, I'll just continue Fania's question, and that is about the social the social protection program. And she asked to Pak Maliki if there is a plan by the government of Indonesia to extend this program, increasing coverages of social assistance and etc. Probably, also mentioned about PKH program and things like that. Okay, so let me turn over to the speakers. Maybe we'll start from Santi.
Thank you, Pak Arianto. Okay, so for the first question, the role of CSO, I think if you put think tank and research institutes under the big umbrella of CSO, I would say that first and foremost, we have to help policymakers, national government and local government in figuring out things, to put it simply. And this is by, of course, generating quality evidence. And not only evidence, but also helping to turn the evidence into policy proposals and then assisting the implementation of those recommendations. I think that would be the one side of the CSO role. The other sides, because PUSKAPA, for example, is also working together with public health CSOs such as CISD, for example. I understand CSOs like CISD help mobilize volunteers for some of their pilot Puskesmas-based interventions for COVID in West Java, for example. And that's another role that CSO can take. But it really depends on the scale of the CSO, the specialty of the CSO. So I think, first of all, understanding where you can contribute and then do it well. I think that would be my answer. The second about Pak Terry. Hello, Pak Terry, how are you? That is very correct, Pak. And I would say that for death registration, because we don't have a way to track national situation, the state of death registration, I would be happy to inform you that our last survey in select areas of KOMPAK, for example, discovered that within households that experienced death in the last 5 years, only 12% of them actually register for a death certificate. So I think that pretty much gives us a picture of how challenging it is. On your question about the 2021 sample census and how we should grab that opportunities, I very much agree. And in terms of budget, I think Pak Maliki and Bu Lisa would have better answers on that. But I would say that since 2019, Indonesia has our first ever national strategy on CRBS. So it's basically to improve civil registration and to improve the accessibility and the utilization of vital data. I think we should use that presidential regulation as a cross-sectoral platform, including development partners, in trying to improve all the situation. And I agree with you that one of the first important steps is to convince Home Affairs to open their data to be used by other sectors. It doesn't have to be us, Pak Terry. Let's just start with probably technical ministries, because I think there are some trust issues to be resolved there as well. The other presidential regulation that I think would also be helpful is the One Data presidential regulation, and I'm inviting also Pak Maliki and Bu Lisa to comment further on that, because I think it creates an entry point for us to argue for public data should be able to be used by the public of course with certain protocols and whatnot. Pak Budi, I slightly disagree with your notion that there must be a COVID-specific intervention. And I tell you why I think that is. We have learned, at least in public health arena, we have learned from HIV global epidemic, is that when health sectors start arranging and implementing HIV-specific intervention, that when all other problems follow. And it means it takes away the capacity from the health sector to really focus on this one disease, while we should be looking at COVID as just one example of communicable diseases that Indonesia is still very prone for. So I would actually advocate first, Pak Budi, to take this pandemic as really a learning curve, which we have to take in terms of, okay, admitting that we still have past homework and we have to address those very soon. And then try to make sure that whatever intervention being designed and implemented for COVID specific really considers how it would in the future be accommodating for a more integrated approaches. I'll give you one example. In West Java now, there's a pilot project called PUSPA. It's basically a Puskesmas-based COVID intervention that focus on the 3M, the masking, all the prevention efforts, and also the tracking, tracing, isolation, and treatments. So for the prevention effort, this program is designed to be cross-sectoral from the very beginning. And just to give you one sub-example of how that would relate to the population data is that we're advocating for PUSPA to consider also tracking the demand of legal identity document, because as soon as they reach out to population, they will see people without a legal identity document, and to make sure that the mechanism is available to connect them with civil registration mechanism, and to make sure that their data then become registered in the system. So that's just one really simplistic sub-example of that. Thank you, Pak Arianto.
Thank you, Santi. Pak Maliki, may I invite you to respond? Oh, or maybe Bu Lisa first. Silakan, Bu.
I think Pak Maliki first. Maliki first, please.
Okay.
Okay. Actually, Bu Santi already answered more comprehensive, yeah, on data, especially. Yes, we are still looking forward for developing good method. On one is actually on how we can improve the quality of the data itself, and then we also looking forward for integrations between some of the data that we already have. Census as well as Dukcapil, we already in quotes integrated, yeah. But I think there is a few things that we still have to do, especially Pak Terry. Yes, indeed, that in 2020 there is a lot of budget cut, and I'm not sure if we already have an analysis on how it is actually affect the quality itself. When I look at the proportion of the elderly based on census, that is also, I have a lot of questions on that too. So I think we have a lot of homework with that. And then for the social registry, hopefully we are looking forward for this system to be established at least in 2024. There's a lot of challenges, of course. One of them is in coordinations, of course, always coordination, but hopefully we can taking care of it, yeah. And then Bu Enda, the role of CSO, of course, this one is very, very, very important. A lot of, I mean, if we are talking about the project-based, project level, a lot of projects that have been supported by the Australian government already saw that. Bangga Papua show that the role of CSO, the role of the local government, of course, also is like how actually the engagement between CSO and also the local government is have to be maintained in order to have the good quality of the programs. Mampu also show that, KOMPAK, some of them, yeah. I think that is just show that the CSO role is very important. When I look at the CSO roles in the data of especially for the inclusions of some of the vulnerable people that maybe the local government doesn't see, or maybe already like intentionally exclude. This is also have to be control. Have to be there is some control mechanisms and I see that CSO have a very important role on that. Not only that, of course, also the programs implementations. Some of the grassroots level, usually the local government have some limitations or inefficiency, and I see that the CSO can also have a very good or strong roles on this one. So that's only among two among a lot of roles of CSO that we can see from all the best practices that we have been through. I think Bolisa can also explore that one because Mampu emphasize the role of CSO on implementing the programs. For the social protections coverage, Bu Fanya, actually during the pandemic COVID, the social protection coverage is already like almost 60 to 70% of the total population. And most of them is like social assistance. We are looking forward for something more sustainable, such as economic empowerment. So for now, we see that it is enough for the social assistant with that large coverage. But then we have to identify who actually in the vulnerable groups that needs the economic empowerment. Integration between economic empowerment, skill development, as well as the social assistance is, I think, is the key too. But I think for now, for the social assistance, we have to start to reduce this coverage and then just focus on the most vulnerable, the poor and the chronic poor. Then we have to start with the economic empowerment. Actually, Pak Budi, the programs for specific COVID, I mean, some of them we don't mention because I think what we are looking forward is after the COVID. And what we already mentioned is also as lesson learned from the COVID itself. So some of the programs still exist, but then how actually we can improve our social protection, especially that is more adaptive. So then if there is something, natural shocks or climate change or other social shocks such as pandemic, we can more adapt to the conditions and also have a good response. That's all I think.
Thank you, Pak Maliki. Ibu Lisa.
Okay, thank you very much. I think the two presenters has already answered all the questions. But I will focus on how is the role of the CSO actually, because I have a lot of experience with the Mampu project, supporting by the government of Australia also through the DFAT. There is a lot of role that can be played by the CSO. So during the implementation of Mampu project, the big CSO can also empower or improving the capacity of other CSO in the local region. So they have the same perspective, the same idea, the same goals to how to say, to tackle some issues. For example, in the Pampus project about how to empower the women. And also, for example, another specific focus on the child marriage. So I think this is the common idea can be built through the coordination and cooperation among CSO itself. So we have the same focus on that. And also how we, how to say, the CSO can also improve the capacity of the target group that can be, that as already Pak Maliki mentioned, maybe that cannot be reached by the government or the local government. So reach the unreached. So I think this is the very important for the role of the CSO. And also give the evidence that already Bu Santi mentioned before. Give the evidence about what's going on in the field, and it will give like an how to say, input for the government to, how to say, to prepare the next intervention or maybe like a policy to handle the situation, the current situation that give by the CSO. I think this is a very important, because sometimes the government cannot reach up until like in the grassroots level. but the problem itself is come from the grassroots level. So this CSO has a role on that in that part, and also how the CSO can, how to say, improve the capacity of the local government itself, especially to tackle some issues. Maybe the CSO has some experience on some issues, and they can leverage the capacity of the local government to tackle the issue based on their experience. So I think this is the role of a CSO is very important in, how to say, in delivering the government project also. One of the example through the Mampus project about how the poor people, especially for the women who are poor, can reach like a PKH or maybe like another social assistance that maybe they still not covered by the system. So the CSO try to connect this vulnerable group to that services. So this is a very important role for the CSO. I think the government cannot conduct everything by themselves. So we need, how to say, participation from all the other stakeholders, including the CSO, to help the government to implementing the program. So I think this how to say, the important thing of the CSO, yeah, the role of the CSO is very important during Mampus project, including the childbirth certificate, yeah, birth registration. They are really help the family who has a children that has no birth registration to have the birth registration. They already that I already mentioned that they try to connect them, to give them knowledge, to give them the, how to say, understanding about the importance of the childbirth registration, and connect them to the services. Because some of them, because they don't, the vulnerable people doesn't have to say, information about that program, about that facilities. So this CSO can help them to open their how to mind about the importance of the childbirth registration. So a lot of role actually that can be done by the CSO. And about the data collection that Pak Maliki has already mentioned also, that about the budget. We know that now we are still facing the pandemic. Most of the budget is allocated to how to say, to tackle this pandemic, and also how to improve the economic condition in Indonesia, because during the pandemic we have a minus growth in the in our economy. So of course the data become the allocation budget for the data become struggling, for us. What we try to, how to say, deal with that is what actually is under the Pak Maliki's coordination, how to integrate all the data become one. So we try to, how to say, make the coordination among ministries who has a responsibility to take the data in the field to work together. So hope it will more efficient, because we can, how to say, we can try to merge some, for example, some data survey instrument or something like that. So I think Pak Maliki can elaborate more on that, because it is under Pak Maliki coordination in the try to build the social protection system. So this is the how to say, the way of we handle with the limited budget in terms of the data. I think that's adding the answering the question from the two speakers.
Thank you so much, Ibu Lisa. We just hit our time actually, so I have to call it to a close. Our guests today have been Ibu Santi Kusumaningrum, Ibu Lisa, and Pak Maliki from Bappenas. Thank you for all the speakers. Thanks for the attendance. And I apologize for those whose questions cannot be addressed at this moment. And with that, let me turn this over back to Nuke.
Hi, Acha, thank you. And thank you to all speakers and participants. This podcast is recorded and will be available for viewing at a later date from our website. I just want to announce that our next global seminar is on the 24th of March, and it's with the OECD. Andrea Goldstein from the OECD will present the 2021 survey on Indonesia. Thank you. And with this, I end this seminar. Thanks.
Thank
Thank
you.
you.